Good morning, everybody, and welcome to today's workshop exploring shared decision-making and specifically making shared decision-making a reality in clinical practice. And we're really pleased that we've brought together some of the key voices, really, in relation to this whole discussion of shared decision-making. So we're delighted that joining us online this morning and in the room in person, we have patients, we have professionals, most obviously osteopaths. We have representatives from the regulator of osteopaths, so the General Osteopathic Council, and we also have people like me, academics, researchers, and teachers in the room. So we're looking forward to a really thriving discussion all about this theme of shared decision-making. My name is Richard Huxtable, and if, in terms of my day job, you like my students, you might be thinking, why on earth is this guy standing up in front of us? Well, there is a professional reason I'm here, which I'll say a little bit about, but there's also a personal reason, which was unknown to Fiona, Rachel, and colleagues who kindly invited me. So around about 30 years ago, I was diagnosed with rheumatoid arthritis, which involves recurring waxing and waning back pain in addition to elsewhere. So I'm delighted there's a room full of osteopaths, but I will proceed ethically. And it's important I proceed ethically because in the day job, I am a professor of medical ethics and law at the University of Bristol. And I head up a team in the medical school called the Centre for Ethics in Medicine. And we are a broad team. We engage with patients, the public and professionals. We, of course, teach trainee doctors, and we also engage in research. Research focused on primarily, I would say, clinical ethics and indeed clinical law. So we're very much interested in the everyday interaction between professionals and patients. Various things I could say about that. One of the reflections is in the background, despite the fact we do a great diversity of work, certain themes do recur. Most obviously, of course, that primary commitment to serve the interest, the welfare of the patient. A second theme we encounter a great deal is around building good relationships in healthcare and the importance essentially of trusting relationships between the professional or the practitioner and the patient. And a third one that I also think comes very much into the room, whether online or in person today, is the whole theme around respect for so-called patient autonomy. And there are lots of different accounts of what we understand by this idea of patient autonomy. But if we go all the way back to its roots in ancient Greece, then the word autonomy derives from two words, essentially. Auto, which is self, and nomos, which is rule. So it's all about respecting people's abilities and indeed their rights in relation to decisions about themselves, their values, their wishes, their perspectives. It's really listening to the person at the heart of the healthcare endeavour and ensuring we're respectful of their values, views, wishes, and so on. There are, of course, a great many different ways in which this ethic of respectful autonomy plays out in healthcare. One of the crucial ones, which we will reflect on a great deal today, I'm sure, is the whole idea of the importance of ensuring there is respect for consent. Essentially, there is consent from the patient for whatever might happen to them and their bodies, or indeed their information. Now, I don't know if there are any fans, as I say, online or in the room of the American drama House MD. I will just briefly reflect that one of the episodes that resonates for me in my work in medical ethics is an episode where he says, well, once you start allowing people to consent, pretty soon they're going to be asking for informed consent. And he's quite sarcastic about that, and I think anyone who's watched the show would know that he's not the ideal ethical role model. But in terms of the importance of this notion of autonomy and correspondingly informed consent, I think ethically is right. And if we look to patients, professionals, and regulators, we hear them themselves signalling, yes, absolutely, communication, respectful communication, and indeed respect for what's important to the patient is crucial to that encounter. But at the same time, unfortunately, we know that things can go wrong. And certainly we've had patients express, including in recent inquiries and reports, their concerns around substandard, even harmful care, harmful interactions, that have involved some disrespect for their autonomy, some failures in informed consent and the like. So a few recent examples. We had that report in recent months in relation to maternity care. Going back a few more years, we also had reports around surgery, involving particularly experimental surgery. And amongst the concerns that came up in both inquiries were concerns around shared decision-making, consent, respect for autonomy, fundamentally listening to and engaging appropriately with the patient at the heart of the encounter. Linked to that, we also have from the Professional Standards Authority a recent report, Safer Care for All, that further recognises that there can be failings in listening to who the individual patient is and indeed what matters to them, mindful of health inequalities, different cultural values, and so on. So there's a great deal in the background there. At the same time, we know a great many professionals do take that encounter and these ethical obligations seriously. And we should also recognise that there are certain challenges and constraints in the professional context, not least in recent years with the advent of the COVID-19 pandemic and the pressures that's imposed, and of course, ongoing pressures in relation to resources and resourcing. The regulators, for their part, of a variety of the health professionals say they're trying to help. So amongst the things they do is set standards and expectations of professionals, including in relation to shared decision-making and consent. But they in turn then hear from the professionals, including, we understand, from osteopaths, that what the regulators are saying doesn't quite map onto the actual realities of clinical practice. And that's our focus today. We're picking up on some of these background ethical questions, concerns, and principles, and trying to make them a reality with a sharp focus on this idea of shared decision-making linked to autonomy, consent, and so on. So what else is there to say? Well, a couple of things to say about our overarching goals. You can see that the headline goal is really to explore and make a reality this idea of shared decision-making. Specifically, we want to explore why it's so important, and we'll reflect on that throughout the day. We want to think about the impacts of the interaction between the osteopath or another professional and the patient, and what makes things go well and indeed less well, and what can those outcomes sometimes be, whether good or bad. And in very concrete terms, we want to introduce and share with you some resources that have been developed to try and improve and make a reality this whole notion of shared decision making.